Greetings. What I want to do today is spend a little bit of time talking about the psychopath, the sociopath, and the diagnosis of antisocial personality disorder. In your textbook, there's an excellent discussion of the differences between sociopaths or psychopaths. Please note that sociopaths and psychopaths um, are defined by a variety of characteristics, but we don't have a formal mental disorder or diagnosis for psychopathy or the sociopath in that sense. But what we do have, which would be closest to that, for adults it would be antisocial personality disorder, and for children or adolescents it would be conduct disorder. So it's important to realize when we talk about psychopaths or sociopaths, we're not talking about a formal mental disorder in the diagnostic manual. So the first thing I like to do is spend a little time differentiating, and Dr. Hare really is the expert in that area. On the last PowerPoint slide, there is a link to Dr. Hare's website, and if you go to that website, you can see that he has published an article in the annual review, and that is a very comprehensive article about psychopaths. And if you have an interest in further your studying about that, then please read that article. It's a superb summary, explanation, and integration of where we're really at in the field. So sociopaths tend to be different than psychopaths in a variety of ways. The major ways pointed out by your author are their skills, their intelligence, and their experience. For example, the psychopaths become better at playing these psychological manipulative games and often are able to control much better than the sociopaths. So psychopaths tend to have average or above average intelligence, and they may have a very little criminal history. And even though they're antisocial in that sense, they have a lot of skills where they can fit in with their environment, and why they have emotional limitations with their responses to others and their empathy and the like. They are able to fit in and manipulate, and often do well in society. In fact, some argue that certain high-paying positions in society are well suited for those that would be considered psychopaths. In contrast, sociopaths tend to have long histories of engaging in criminal activities, average to below intelligence. Again, they tend to be antisocial as well, but they're more likely to have less impulse control and more likely to get in trouble for impulsive acts and violence, and their social skills are much more limited, so they're less likely to be able to do a lot of the things that the psychopaths do in order to fit in society. So in looking at some of the characteristics of the psychopath, and we look at Dr. Hare's PCLR, there's two major factors that are discussed in that. There's and these would be characteristics. Factor one, for example, you would see characteristics, for example, glibness or superficial charm, a grandiose sense of self. In other words, they think they're all important and everything they say is just amazing. Often pathological lying. They don't feel guilt or remorse when they engage in activities or harm to others. A very shallow affect or shallow feelings, and also callousness or lack of empathy. And they also tend to deny responsibility for their actions that harm others and blame others. And those are considered the tools of the psychopath. And additionally, Dr. Hare points out in the factor two, the deficits of the psychopath would be the need for stimulation or overcoming boredom, their parasitic lifestyle, their behavioral problems or lack of control, which would be their impulsivity, their irresponsibility, their delinquency in their juvenile years, and also the problems with the legal system. Now, what I want to mention as a third discussion. So we talked briefly about sociopaths, briefly about psychopaths, and now I'm going to bring in, this is the desk reference to the diagnostic criteria for the DSM-5 published by the American Psychiatric Association. Okay, here we go. What I want to mention is right now as I make this video, it's only been a few months since this came out. This is the revised manual, or this is actually, I'm sorry, this is the desk reference. The actual manual is close to 1,000 pages long and very, very very much a load of information is in that manual. This is just summarizes the diagnostic criteria, basically. So if you're going to be doing research, obviously if you're going to be doing clinical work, you would want the actual manual. This is a lot easier to carry around. You don't get these back pains from carrying that manual around, and it fits in your glove compartment. Okay, so anyway, in August, I'm sorry, in May of 2013, in May of 2013, it's actually August right now, 2013, when I'm making this video. The Diagnostic and Statistical Manual 5th edition was released at the American Psychiatric Association meeting. That is a major paradigm change or shift, I would say, in the field, because there's some changes and important changes. That means that a lot of the material that we're reading is now outdated because we have a new manual with some changes. Some things have been added, some things have been changed, some things have been removed. I highly recommend that you either take a look at the actual diagnostic manual and read the chapter on the changes, or you can get a nice summary at the American Psychiatric Association website on the changes going from DSM-4 TR or text revision to the DSM-5. So I wanted to mention that there are changes. One of the interesting changes is now post-traumatic stress disorder is moved out of the anxiety disorders. That is one interesting change. There's a variety of changes that are very relevant, and changes even in the names of the diagnostic criteria. But I do want to mention a few things before I get into the antisocial personality, and that is that it's important to recognize that that this is not necessarily a situation where you're going to be where people would get diagnosed and then it would be related to criminal activity or criminal risk. There's a cautionary statement actually that they make in here on page 13 where they say where they have a section cautionary statement for forensic use of DSM-5, and they recognize that it's often used in the courts and by attorneys, but they also state it is also important to note that the DSM-5 does not provide treatment guidelines for any given disorder. So they're not providing any treatment. And so the main point here is that even though if someone's diagnosed, doesn't necessarily mean that they're at risk for violence or criminal activity. And I think the most important thing that I should point out and can't stress enough is that mental disorders are not highly related to violent behavior. That there are a few mental disorders where the risk is indeed higher, but for the vast majority of mental disorders, there's not a relationship with criminal behavior. So the big problem, of course, is if we see someone engage in criminal behavior and it's outrageous crime and it makes the press, there's a focus on a certain mental disorder. What's important to recognize is the vast majority of people who would be diagnosed with that mental disorder, save a few maybe, would be engaged in law-abiding behavior. So I don't want you to, having a mental disorder would be a risk factor just as other risk factors would be present, but it would depend on the specific mental disorder and the extent of that particular disorder. So my main point is I don't want people, seeing others that are labeled with a mental disorder as being at risk for criminal behavior. If you want to use indicators of risk, being male and being young are much greater risk factors and are much better predictors of violent criminal behavior than mental disorders. I hope I stress that enough. But antisocial personality disorder is indeed considered to be a mental disorder, and we have it in here under cluster B personality disorders. And to just kind of give you an idea that it's and I'll quote from the DSM-5, a pervasive pattern of disregard for the violation and the rights of others occurring since age 15 and indicated by 3 or more of the following. And then they have a list of behaviors, for example, deceitfulness, impulsivity, irritability and aggressiveness, reckless disregard for others' safety, and the like. And so, of course, I'm not going to go into detail on the diagnosis, but to recognize that this is different than the sociopathic and the psychopathic categories. Also, it's important to recognize that the person must be at least 18 years of age. There are similar similar behaviors that could be exhibited, for example, by an adolescent, but that would fall under a conduct disorder. It seems that the research shows that that kids that are diagnosed with conduct disorder, most will not go on to have a diagnosis of antisocial personality disorder. But those with antisocial personality disorder would have been diagnosed with conduct disorder. Also, the occurrence is not explained by other specific mental disorders such as schizophrenia or bipolar disorder. And so I think that's helpful to recognize, and also it's important to recognize that even people that would receive a diagnosis of antisocial personality disorder are not necessarily engaged in criminal activity, nor are they engaged in violence. So again, it's a risk factor, but that's really what I want to emphasize, that I don't want to focus on mental illness as being a major risk factor for violence. So, it's one of those situations where you can say that there's a relatively large proportion of the population that might be diagnosed with mental disorder, and a very small proportion of those will engage in criminal or violent behavior. And that's, like I should say, a lot of a vast majority of people who diagnosed without mental disorder, a small number engage in violent criminal behavior. So I reiterate that again. And so again, I would highly recommend, if you have an interest in pursuing this, study the DSM-5, look at the American Psychiatric Association website, look at the changes, and there's a wealth of information on the website. There's been a lot of changes. In one way, it disrupts, because I have to change all my notes, I have to update everything, I have to learn about all these changes, but also it's a very exciting time, because not only do we have new things to look at, but we can also critically evaluate. And I can tell you there's a lot of debate about these, and there's going to be a lot of discussion, and it's going to be an interesting time for those that are studying these phenomena. Thank you.